Which one is the best way to lose weight? GLP medicines like Ozempic or bariatric surgery? We Americans, we like simplicity, we like drama, and we love competition. So it's no surprise that these options would be pitted against each other, the either or, the single right answer, almost like a gladiatorial contest in the doctor's office. But it's actually the wrong question to ask. We shouldn't think of either medicines or surgery for obesity treatment. We should understand that they are part of a continuum of treatment. Medications and bariatric surgery are often mutually reinforcing. And the modern strategy for obesity disease management is to use all the available tools to achieve the best possible sustainable benefits for health. Now, I posted a video a couple of years ago that fully describes the continuum of obesity disease management, so I won't go back through all the details here, but I firmly believe that both medicines and surgery have a place in the lifetime management of this obesity disease, and they both work best when they're employed on a foundation of lifestyle change. Lifestyle change means healthy food, regular exercise, and shaping your environment for healthy metabolism. I like to picture this integrated obesity disease plan as a pyramid like this. Everything is based on lifestyle optimization as a foundation, the starting level. Depending on the patient's situation, they might add medication or perhaps even jump from lifestyle intervention to surgery. But notice that I talked about lifetime management. So in my view, patients should stay with this pyramid. Whatever treatment they've had, they should regularly circle back for updated staging and an updated treatment plan. All these levels should be available to provide the right treatment at the right time for each individual. So back to this question of Ozempic versus surgery. I already said I don't think it's the right question to ask, but what would be some better questions? And I think those questions are going to be along the lines of, what do we expect to be the impact on this obesity disease from each of our treatment options? I mean, what's the weight loss? What are the health benefits? And what are the risks of each intervention? And it turns out that even though the new meds are awesome, bariatric surgery leads to significantly more weight loss and health improvement in the short term and especially in the long term. It looks like surgery is going to remain stronger and more impactful even when the next couple of generations are accounted for. But surgery also comes with, surgery and potentially complications. And so choosing surgery can be sensible, but it's also crossing a bridge. So I think the right question is, what's the right treatment for this person, this individual at this life stage? The first thing we'll need to figure out for that individual is, what's the level of disease? What's the intensity of the obesity disease for them? And we're getting better at figuring this out. And then once we have that understanding, we can work together to choose the right treatment at the right time for the most sustainable health benefit. In these discussions, of course, we have a range of treatment options available to us, and one way of comparing these treatment options, not the only way, but one way is to look at the comparative weight loss percentage for each option. This bar graph maps out the percentage of weight loss with each of these treatment options. Notice that lifestyle treatment alone leads to about 5% weight loss, and that meds are clearly better than lifestyle alone, and that gastric sleeve or gastric bypass win over the modern weight loss meds such as Wegovy, which is also called Ozempic, or Zepbound. Interestingly, this graph is based on statistics from the FDA trials for Wegovy and Zepbound, but so far in real-world use, these meds seem to be about half as effective as they were in the FDA trials. But comparing these options for weight loss treatment should look at more than just the pounds that are lost. I mean, there's more to health than just the pounds on the scale, right? If we look at the best way to treat an individual with their obesity disease, we have to understand them from several perspectives at the same time, and then together use the intersection of these considerations to choose the best intervention to try. Some of the other questions that we should look at, or axes of consideration, would be what's the stage or intensity of the metabolic obesity disease? And again, not just the pounds on the scale, but what's the level of diabetes or high cholesterol or cardiac risk? That's one. What else has been tried? What are the side effects of the different treatment plans that we have in mind? What's the cost of the different treatment plans that we have in mind? What's the overall sustainability? Are we going to be able to keep going on this treatment in the long run? And do we have to choose one single intervention, or better, a combination of interventions like we do in cancer treatment? Now, I've been having conversations with patients about their weight loss options for many years, and there are several recurring themes that come up that I think we should expand on here. The first of these themes is that lifestyle change is essential for success in the long run. Lifestyle typically is the option that has to come first, foundational, and we keep coming back to depending on what we add on top of it. Nothing else we do, whether it be medicines or surgery, is going to be as effective as it can be if we don't do healthy food intake and add in some exercise. The second thing I want to bring out is that when I reviewed that table a minute ago, or those graphs with the weight loss, I kind of skimmed over the complications and the side effects. The side effects from the meds, they can be pretty common, like nausea or other gastrointestinal symptoms, but most of the complications, except for stuff like pancreatitis, which is rare, are not dangerous, and most of the side effects from the meds go away once the meds are stopped, if they need to be stopped. On the other hand, surgery side effects have a whole range from nausea during the recovery phase, which is pretty common, but it resolves completely with time, up to rare but really serious and permanently life-altering impacts or complications such as blood clots or bowel obstruction. And there's a lot more to be said, but it's clear that each treatment has pros and cons that we should consider. A third common factor that comes into these discussions is the sustainability piece. Very often a patient chooses treatment with meds and finds the meds are useful, but may not be sustainable due to cost or due to side effects, or maybe just the fatigue factor from keeping up with the medications. Given that meds and surgery have many of the same hormonal side effects, a wise surgeon friend of mine once said that having a sleeve is having like a lifetime supply of Ozempic. Since there are so many factors to consider, I think the right plan is to seek expert medical consultation as soon as the obesity disease shows up as a problem. At the very early stages of the disease, lifestyle change such as an optimized food plan and activity increase can be impactful. But when a person gets to be more than maybe 25 pounds overweight, and especially if they have medical conditions related to the weight, then lifestyle interventions alone are unlikely to lead to lasting health improvement. And that's where meds come in, and the option for pharmacologic treatment of the obesity disease, of course, with GLPs, has recently improved quite a bit. Taking this a little bit further, if a person gets to be more than 50 pounds overweight, give or take, and especially if there are weight-related medical conditions and metabolic disease, then usually surgery is going to be a useful option. Depending on the individual circumstances, it still might make some sense to give weight loss meds a try. If the meds are successful enough in controlling the obesity disease, then surgery can be kept on hold more or less indefinitely. And that's great because the patient can avoid the risk and the downtime associated with surgery. But on the other hand, if the meds aren't fully successful, then there shouldn't be any blame, but really more of an acceptance that all the reasonable options have been tried before the surgical option is implemented. Sometimes a person who has already had bariatric surgery continues to struggle with weight issues or disease issues associated with the weight. And in these circumstances, I like to make sure that we're doing everything we can from a lifestyle perspective. Again, healthy food, increased activity, checking vitamin levels. But once that's done, I do not have any objection to plugging in meds to work synergistically with the surgery to get the best lasting sustainable outcomes. Now, I guess you've gotten my theme by now. I think we ought to be looking for an integrated spectrum of options to gain the most health in a lasting way. We're not so likely to be successful with just one tool or the other tool, but by having all the tools available. The tools may be used singly, but more often they're used together, and we always want to work to find the best synergy to give patients the lasting health that they deserve. I like to think about a team approach to this complex obesity problem.